The surveyor may interview departmental staff in a group setting or may interview staff on an individual level.
In this setting, this is the what unit?
This is one of our fluoroscopy units.
Okay. So when you're setting up for a procedure, how do you protect yourself from radiation?
I wear all this gear, starting with a lead skirt. It goes all the way around my waist. And then the top of it. And the thyroid shield. Lead glasses.
Great. Thanks.
Radiation safety guidelines to remember. Be prepared to describe your department's policy on patient and staff radiation protection. You should have all necessary protection equipment and supplies readily available to demonstrate compliance if asked by the surveyor. Always wear your radiation badge in plain sight and be prepared to explain to the surveyor the Imaging Services Departmental policy on badge readings. You may be asked questions like, who is responsible for checking badge reading reports? How often are badge reports reviewed? Or what process is followed for readings indicating excessive exposure? Your surveyor will want to know how the staff in your department are evaluated for their clinical competence.
I'm curious to find out from you what your process is to evaluate for age-specific competencies.
You mean with our particular age groups in this here in this area?
Right. Considering the fact that you do treat pediatric, adolescents, adult, and probably geriatric patients, I'm curious to find out what the process is here to assure that you and your colleagues are, top-notch in terms of capable of managing those kind of patients.
We all go through, I believe it's a yearly evaluation of the competencies, our skills in the specific areas, and also I would say that we all get a lot of experience with the different age groups, especially over here. I did a baby early this morning. I'm dealing with a younger gentleman next door, and we've got geriatric patients that come in on a regular basis as well, so we get a lot of experience with it.
So there's a lot of monitoring by the radiologists, your colleagues, to make sure that your skill set are as sharp as it possibly can in this setting. Use like a checklist type of mechanism? Is there a checklist of things that you folks are supposed to be good at?
Yes, our manager, like I said, we go through that evaluation yearly, and it is a type of questionnaire that we go through, checking off that we're competent in all of those specific areas, and in conjunction with her evaluation of those skills and whatnot.
Your surveyor will be interested in learning how imaging services staff demonstrate competency in the following areas: knowledge of theory and physical competency in performance of procedures and treatments, staff competence in managing age populations specific to their unit, competence in management of the patient's cultural, religious, and/or social issues that may impact the delivery of care. The surveyor will want to know if your staff is competent to apply and remove restraints. Your staff must also be competent to identify and report victims of abuse. The surveyor will want to know that your staff is trained and competent regarding hospital safety, security, and infection control practices.